My my skin problem started around 2 or 3 years ago, where I started to develop red patches, red rashes on my legs.
Every day is a happy day. So when the rashes first began, was there anything else? Now you have identified that stress was one of the factors, and possibly there was some sort of water contamination that added to the problem. Was there anything else that was unusual for a while before those rashes came up? Was there any other situation in life? Was there any other medication taken? Was there any other different types of food eaten? Anything
I
that
don't
could have
remember.
precipitated?
I don't remember if there were other medication. I don't think there was. I think it was probably a lot going on in my life right then at that moment in time, and because I've never had those type of skin issues before, I was just really surprised that the doctor said I had eczema, because I've never had those type of problems before. So I suppose I just trusted that judgment that it was just eczema and I could put cream on and I would be able to deal with it.
And did it go away when you used the cream?
It did immediately, but I felt like every so often it would come back up. So it felt like it was never resolved, that it was on a superficial level. I was just clearing up my skin and making the itchiness kind of less, but it never dealt with the root of the problem.
So we need to find out what are the factors that are contributing to this rash coming back again and again, and not just about making the rash disappear once.
Yeah. That would be good.
So what we would do in the treatment with homeopathy and nutritional medicine is, of course, I'll have a look at your rash and see where and what's going on. At the same time, it would also be important to take your complete homeopathic history, where we ask not just about the body, but also about the emotional situation, past history, family history. We go into details about when the rash is itchy, when it's not, when it flares up, things that can make the rash go worse, things that can help it get better. We would also do a nutritional profile and see what's going on, check if there are any triggers, and then we would help. What we can expect with the treatment is it will take a bit more time, so it's not something that we start and it's gone. It doesn't work that way, because here we are dealing with the root cause. The aim is to make sure your body does not break out into rashes again and again. So we would start helping you in a way where the discomforts reduce and slowly the recurrence also goes away. And at the end of it, we also take care of the scars that would have remained from past rashes.
I think after now 4 or 5 months of treatment, I'm really seeing a big improvement in the way my skin is reacting. I definitely have less flare-ups. I'm really not using steroid cream at all now. I'm not relying on it when I have flare-ups. I'm not relying on the use of steroid cream anymore. And I think even that has made me feel a lot better, because I know the prolonged use of steroids is not good. I feel like I'm dealing with like some of the root causes of the issue, especially knowing when certain foods might trigger a relapse or will make me more itchy. And just knowing that has helped, because I can eliminate certain things and stop that from happening. And even that makes me less frustrated with my issue, because I'm much more aware of some of the problems that might be caused by, environmental issues or like food related issues. So that's really helped a lot. I feel that if I have friends that I know who are experiencing similar problems, I would definitely suggest them to explore the homeopathy route as a possible solution, rather than rely solely on Western medication, because I think certainly with Dr. Sona's treatment and approach, it helps deal with some of the root causes of maybe symptoms that we display and that sometimes we're unaware of, that are connected, that triggers some of our issues. So I have definitely valued Dr. Sona's kind of approach in dealing with my problems, and I would wholeheartedly recommend some of my friends to explore this route if they needed to.